Good evening and welcome. My name is Paul Jeffrey. I'm the president of West Long Hospital, senior vice president and chief inclusion officer of Long Health. Thank you for joining us here tonight to do a special program to honor Dr. Alvin Blount. We're glad that he and his family is here tonight. I understand that his children are here tonight, and some of them have traveled from out of state to be here with you. For the family of Dr. Blount, please welcome to be recognized. Blount, I will tell your friends to stand up, but they will all be standing up. Thank you for coming. We are also glad to welcome Mrs. Shirley Barnes, the widow of Dr. Milton Barnes, one of the other plaintiffs in the Simpkins versus Moses case. Tonight, her daughter is here with her. Her son could not be here with us, so we thank you for being with her. As you may know, as you all know by now, Dr. Blount and Dr. Barnes were among 6 physicians, 3 dentists, 2 patients, who joined in a courageous effort more than 5 decades ago to integrate healthcare in the nation. In 1962, this group filed suit against Moses H. Cone Memorial Hospital and Wesley Long Community Hospital. When that suit was resolved in 1963, it opened the doors for 2 things to occur, and that is nationwide. One was that black physicians secured the right to practice medicine at previously segregated hospitals. And the second victory was that African American patients were allowed admission to hospitals across the nation under the same terms and conditions as white patients. It is for these achievements that we honor Dr. Blount as a living symbol of what he and others did. The other participants were physicians Walter J. Hughes, Norman N. Jones, Gerardo Alexander, E.C. Noel III, and F.E. Davis. They were joined by dentist George C. Simpkins, Jr., Milton Barnes, and W.T. Miller. Others were patients A.J. Taylor and Donald R. Lyons. All of these men were persistent and opened the door for all physicians and patients, regardless of race, to have equity and parity in the American health system. For this, we salute you, Dr. Blount. Ladies and gentlemen, please watch as we play a video that will give you even greater insight into why we're here tonight.
In 1953, with great fanfare, Moses Cone Hospital opened its doors to treat the citizens of Greensboro, North Carolina. It would be another 10 years, however, before those doors would also open to African American physicians and patients, giving them full access to the hospital's state-of-the-art facilities. It was in Moses Cone Hospital's hometown of Greensboro that the legal battle to force hospitals to give African American physicians full and equal access began, and ultimately succeeded. One of the 11 individuals directly involved in that battle was Dr. Alvin Blount.
As far as we're concerned, you're a hero. You really, truly are. And we just wanted the opportunity to acknowledge you and spend a little time with you, and maybe hear a little bit more from your perspective about what it was like.
I was just coming from an institution, the Army, which had almost everything you want to work with. And I learned there that men can work together regardless of race, color, creed.
When he returned home to North Carolina in 1954, he was quickly reminded segregation was still the norm. Dr. Blount had seen his fair share of battles in Korea. Now he realized there was another one coming right here at home.
There was no demonstrations. There was no strikes. There was no fights. We were trying to do it all through smooth, common negotiation. You must remember we live in a different age. It's the only way we had to write letters to each other. And you get my letter, and I wait for you to answer, then I read it, but then I answer it.
This campaign of letter writing and trying to use discourse to further their cause continued for years. During that time, the increasing national focus on civil rights kept getting closer and closer to home. In 1958, the Reverend Martin Luther King Jr. came to Greensboro and spoke. On February 1st, 1960, 4 young black college students from North Carolina A&T State University, Dr. Blount's alma mater, staged a sit-in at the Woolworths in downtown Greensboro. The Woolworths sit-in became one of the most enduring moments of the civil rights era. Dr. Blount and those aligned with his battle for equal treatment at the hospital realized it was time to try a different strategy. Led by dentist Dr. George Simpkins, they filed a lawsuit against Moses Cone and Wesley Long hospitals in 1962.
He said that if we lost, we would really be sitting over there talked about. And if we won, we'd be heroes of America. So some of us were brave enough to sign on.
In Simpkins versus Moses H. Cone Memorial Hospital, the 11 plaintiffs argued that the use of public funds to expand and maintain segregated hospitals was illegal. In essence, the doctors were challenging that either the hospitals should immediately admit black physicians and patients or forfeit any and all allotted federal Hill-Burton funds. The Hill-Burton Act of 1946 essentially created a pool of funds to help build, run, and expand hospitals throughout the United States. In what must have surely seemed like a coup for the plaintiffs, Robert F. Kennedy, then the U.S. Attorney General, even filed a friend of the court brief on behalf of the plaintiffs.
We figured the courts was a nice, quiet way of going about it without having everybody marching over the Cone when the flag opened up.
Unfortunately for Dr. Blount and his co-plaintiffs, the court initially sided with Cone. The 11 plaintiffs and their lawyers were not about to give up, however, and quickly appealed to the U.S. Court of Appeals. Less than a year later, in November 1963, the court found that the hospital had violated the 5th and 14th Amendments because they had accepted Hill-Burton funds. After the Supreme Court denied to hear the defendant's appeal, the battle was over. Like the Greensboro Four, the plaintiffs in Simpkins versus Cone had changed not only their own lives, but the lives of every African American in the United States. But to Dr. Blount, only one thing really mattered. He would get to treat patients at Moses Cone.
Thank you for opening up the doors for me and a lot of our colleagues and showing us how we can all work together.
If you would allow me, and I really consider it an honor and an overdue honor, I'd like to say on behalf of Cone Health to you, on behalf of your colleagues, on behalf of the citizens who were denied access for that period of time, I would like to apologize on behalf of Cone Health for the segregation and for the discrimination that you experienced.
With the deepest appreciation for your efforts to apologize for this, I accept it with the fact that for always we'll be together.
Of making amends for past racially discriminatory practices. And I'm pleased to tell you that that resolution passed with unanimous consent.
Thank you, Devin. This is the first time I've participated in the video, obviously, but it's the first time I had a chance to see it tonight. I have to admit that I was very choked up with what the finished product was and what the overall meaning was. As president of the Cone Health Medical Center and medical and dental staff, through the Medical Executive Committee, we wholeheartedly endorse this resolution to honor Dr. Alvin Blount for the past discrimination of Moses Cone Hospital. If you give me just a few minutes, I'd like to tell you a brief story, and the story will be brief. When I first came to Greensboro in the year 2000, which was in the medical directorship of the trauma program at Moses Cone, now Cone Health. My father, who had been a regional representative for the EEOC, Diversity and Community Equal Opportunity and Opportunity Commission, for the regional area of the Southeastern Atlanta in the 60s and 70s. He insisted that I meet Dr. Simpkins when I got here. I'm embarrassed to say that before that, I was not aware of all the sacrifices that Dr. Blount and his colleagues have had to make and endure in order for me to be where I am now. But my father made sure that I understood that. So he arranged for lunch for myself and Dr. Simpkins to go out and have lunch. We did. I met Dr. Simpkins, and as you might expect, it wasn't a big deal with him anymore. He briefly talked about what had happened, what it meant, and then he went on to have lunch, and he asked about me. For him, it was a matter of getting things together to meet the claim down, and no longer did he harbor any resentment for the past injustices. So, because of his sacrifices and what Dr. Blount has done, we can all work together and we work in the environment of diversity and equality. Thank you.
I'm still choked up, so pardon me. But I too am excited and overjoyed to be here on an occasion where we honor the actions of those who forced the issue of equal health care and professional opportunity for African Americans. And I dare say all people of color in this country. I'm particularly pleased to acknowledge and honor the efforts of Dr. Alvin Blount Jr., who I've known for many years and consider a friend, a professional role model, still working. I mean, he sets the bar real high. And he's been a mentor for me in Greensboro since day one, almost 30 years ago. If not for the actions of Dr. Blount, Dr. Simpkins, and the other plaintiffs, I would not have been or not have had the opportunity and privilege to be the first African American to serve as president of the Cone Health Medical and Dental Staff in 1997 or as chairman of the Board of Trustees in 2010. For that, I can publicly say what I've said in private on many occasions to Dr. Blount. Thank you. We love you. Now, it's my great pleasure to read the joint resolution of the Cone Health Board and the medical and dental staff. The heading reads, Joint Resolution of the Board of Trustees of Cone Health and the Medical Executive Committee of the Cone Health Medical and Dental Staff relating to making amends for racially discriminatory practices for licensed physicians and dentists and patients. The body of the resolution states, whereas Moses H. Cone Memorial Hospital and Wesley Long Community Hospital, open parenthesis, the hospitals, close parenthesis, which are both currently owned and operated by Cone Health, were originally formed and operated as independent private hospitals in Greensboro, North Carolina. Whereas in the early years of their operations, both hospitals, like many others in North Carolina and across the state, denied licensed African American physicians and dentists privileges to practice medicine in their facilities and also barred African American patients from admission on the same terms and conditions as white patients. Whereas in 1962, physicians Gerardo Alexander, A.B. Blount Jr., F.E. Davis, Walter J. Hughes, Norman N. Jones, E.C. Noel III, dentists Milton Barnes, W.T. Miller, George Simpkins, Jr., and patients Donald R. Lyons, A.J. Taylor, challenged the discriminatory practices of the hospital in a lawsuit known as Simpkins versus Moses Cone. Whereas in November 1963, the Fourth Circuit of the U.S. District Court of Appeals held the discriminatory practices of the hospitals to be unconstitutional under the Equal Protection Clause of the 14th Amendment, thereby bringing an end to the practice of racial discrimination at the hospital. Now, therefore, it is resolved that Cone Health and the Medical Executive Committee of its medical and dental staff apologize for past racial discrimination at the hospital. Be it further resolved that Cone Health and the Medical Executive Committee of its medical and dental staff renew their commitments to building on the foundation of diversity and inclusion Cone Health has established in the intervening years since 1962. Be it further resolved that Cone Health will designate $250,000 to create an annual scholarship of $25,000 or more for the next 10 years and will receive other donations for the fund. The funds shall be made available annually to the Greensboro Medical Society to distribute as scholarship funds to worthy students pursuing healthcare education. The resolution is signed by Deborah Hooper, Chair of the Board of Trustees at Cone Health, and J. O. Wyatt, MD, President, Medical and Dental Staff, Cone Health. And to Dr. Blount and to Ms. Shirley Barnes, we're very pleased to have copies of the resolution available to you at the end of the program. Thank you.
Thank you, Deborah. Our next presenter is Terry Aiken, Chief Executive Officer of Cone Health. And here he is to announce Cone Health's plan to honor the legacy of Dr. Blount, Dr. Barnes, and their colleagues.
Good evening. It's such an honor to be with you tonight, and it's such an honor to honor Dr. Blount. Before I talk about our plans to, in a little bit more detail, to honor the legacy, it really is important that I read to you some remarks that were sent to us by Edward Cone. And Ed Cone is a current trustee of Cone Health. He very much wanted to be here tonight. However, he was actually in New York seeking some very specialized medical care, medical services for his wife. But Ed sends the following message. It is my honor as a member of the Cone family, a trustee of the health system, and a native of Greensboro, to be even a small part of this long overdue occasion. When Moses H. Cone Memorial Hospital was conceived in 1911, the mission was to serve all the people of this area. For too many years, after our doors opened in 1953, we failed to uphold that mission. It is far too easy to look back on the laws and customs of the time and say things were different then. Because some people stood up. The people we honor tonight stood up. We should have stood up. Dr. Blount, Dr. Simpkins, Dr. Barnes, and the other physicians and dentists who made a federal case out of what was happening in Greensboro were fighting for something larger than the particulars of their complaint. As the Fourth Circuit decision in their favor makes clear, segregated health care had far-reaching negative effects on wellness and quality of care for millions of people. As Dr. Martin Luther King Jr. said, of all the forms of inequality, injustice in health is the most shocking and most inhuman. I cannot be with you in person tonight because I'm with my wife in New York City, where she's receiving some specialized medical care. The doctors here, like our team at Cone today, are a diverse group. Their skills and talents are the only qualifications they need to practice the healing art. That is as it should be, and it benefits everyone. All of us are better for the changes Dr. Blount and so many others fought for, and we are grateful to those who helped make change possible. So again, we regret that Ed could not be here, but I hope you would join me in acknowledging his heartfelt thanks. So let me talk a little bit more about how we plan to honor the legacy of those brave individuals that included Dr. Blount. I must acknowledge that in the early years of our organization's operation, we denied African American physicians and dentists the opportunity to practice medicine in our facility. We also barred their patients from being admitted on the same terms and conditions that white patients were able to be admitted. Regardless of the norms of the time, this was not right. That's where Dr. Blount, Dr. Barnes, and the others stepped in, challenging us to be our better selves. And we're all better for it. Today, to honor that legacy, as was mentioned in the resolution, we will commit $250,000 in seed money, the proceeds of which are intended to be used by the Greensboro Medical Society to award annual scholarships that will help worthy students pursue education and health care. These funds will help kickstart an effort while we work to identify other donors who can join us. And our intent is to give interested and qualified students the extra help they need so that they can provide high-quality health care for years to come. We look forward to working with many of you to create a structure for this initiative to grow and succeed so that many students can grow and succeed along with it. I thank you very much.
Now we will be joined on the podium by Dr. Tim Stewart, who is the president of the Greensboro Medical Society.
Thank you. As president of the Greensboro Medical Society, I'm honored to accept these scholarship funds, which are an investment in our future healthcare providers. I want to especially thank Dr. Alvin Blount for his vision and determination to blaze the path for myself and other minority physicians and dentists in Greensboro. For over 20 years, the foundation of the Greensboro Medical Society has awarded scholarships to students enrolled in medical, dental, and other healthcare professional schools. This scholarship by Cone Health will help strengthen our efforts to help future physicians and dentists achieve their dreams. Cone Health's 10-year commitment to start this scholarship demonstrates genuine concern for increasing the numbers of minority physicians and dentists serving the Greensboro area. We need these future physicians and dentists to help improve the health disparities that exist in the underserved and largely African American community. Thank you again to Cone Health for establishing this scholarship, which will help students overcome financial hurdles in their pursuit of their healthcare career. These scholarship funds will benefit all of us in Greensboro. Thank you.
Dr. Stewart, please stay here on the podium. I'm going to be asking for Terry Aiken and Dr. Jeffrey Hatcher, our president-elect of the Cone Health Medical and Dental Staff Attorney.
Thanks again, Paul. As many of you know, Moses Cone Hospital, the flagship of Cone Health, opened its doors in 1953. And believe it or not, all these years later, we still have some bricks left over from the original construction. We're pleased to present one to Dr. Blount and one to Mrs. Barnes. And if you'll allow me, I'd like to read the inscription that goes along with these bricks. This is one of the original bricks used to build the Moses H. Cone Memorial Hospital in 1953. This is a gift to the families of the plaintiffs in Simpson versus Moses Cone to commemorate their untiring efforts to lay the foundation for the diverse and inclusive organization Cone Health is today. And now, on behalf of all the plaintiffs of the lawsuit and their families, actually, would you all like to everyone deliver bricks? Thank you. And And now on behalf of all the plaintiffs of the lawsuit and their families, I would ask that Dr. Blount please honor us with a few words.
I'd like to say first, good evening. I don't wish to delve in the past. I think that the only a few things that we can say, with our suit, we got rid of separate but equal forever. It paved the way for three principles I have as a result of all we do as citizens of the United States of America. There, number one, let's integrate. But after we integrate, let's just diversify. And the third thing is inclusion. I want to commend you for your efforts in making sure those principles work. Indeed, this has been a wonderful program. Let me say thank you. I want to say thank you again for George Simpkins, Walter Hughes, Tony Alexander, E.C. Noel, and F.E. Davis, their physicians. 6. 3 dentists, Dr. Barnes, Simpkins, and Miller. And I hope that as a result of this program, if we were together today, they would say, we are pleased, but let's carry on. Thank you.
Thank you, Dr. Blount. It is a sincere honor to be here next to you and hearing your words of inspiration. Thank you. You've heard about Cone Health's past practices. You got a glimpse of how Cone Health will invest in and influence the future. Before we conclude our program, I'd like to say a few words about the progress we've made over the past couple of decades and where we stand today. I am very proud to be the inclusion officer of Cone Health because we're doing some extraordinary things to recognize, appreciate, and celebrate the diversity we are fortunate to have among our caregivers, our employees, our patients, and our communities. Celebrating uniqueness is grounded in the values of Cone Health and is central to our operating principles. We believe that our organization is made stronger when we value different cultures, backgrounds, and beliefs because we are then able to capitalize on different skills, different styles, and different perspectives. 4 years ago, Cone Health created my role as a Chief Inclusion Officer and the Office of Inclusion and Health Equity. The intent and commitment is to eliminate disparities in healthcare in our integrated health network. Cone Health has evolved since the 1960s from an organization that engaged in discriminatory practices. I am proud to say that Cone Health is now a more diverse and inclusive organization. Still, we know there's still a lot of work to be done. We continue to strive to become more diverse and inclusive every day and continue to honor the legacy by Dr. Blount, Dr. Barnes, and Dr. Simpkins and their colleagues. I would like to thank all of those who, over the decades, we have several physicians here from the past years, who have laid the foundation for Cone Health within the organization it is today. Let me conclude our program by thanking all of you for joining us today. For those who are leaving right after this program, you must see Paige Dallas in the back in order to make sure that you get your voucher. Again, on behalf of Cone Health, Dr. Blount, Mrs. Barnes, thank you for being the hero that you were for us. Have a good day.